Hi, are you one of the millions of women who's been diagnosed with masses in your breast? If you are, you deserve to hear these incredible results that happened for this lovely lady who came to my clinic here in South Florida. My name is Dr. Lonnie Herman, and she had a mammography scans. We'll show you those right now. Her mammography scan from January of 2020 revealed that in her right breast, look at this report showing you right up close in this video. The right breast had 3 masses. One of them in the right breast was at 3 o'clock was 6 millimeters. One of them at 5 o'clock was 6 millimeters. And one of them at 10 o'clock was 3 millimeters. In this scan also from January of 2020, in this ultrasound, it showed that her left breast at 2 o'clock was 9 millimeters and that at 11 o'clock was 3 millimeters. Now in her mammogram from the same day, let's look at that image right now, January 10th of 2020, the mammogram is showing that she had this mammogram done in January of 2020 as a reference, as a comparison to what they already discovered back in May of 2019. And in this mammogram from January 2020, it showed that there was only one mass at 4 o'clock in the right breast of 9 millimeters, and it showed that the left breast had at 12 o'clock 12 millimeters. Now in this addendum to this mammogram report, it says that an X-ray report which is negative for malignancy should not delay a biopsy if a dominant or clinically suspicious mass is present. This woman, Luisa, never got the biopsy. One more time, in the mammogram, it showed that there were 2, one in the right, one in the left. Her ultrasound showed that there were 3 masses in the right breast and 2 masses in her left breast. Now again, the doctors advised the biopsy that she did not take their advice. I'm not saying what to do or what not to do regarding a biopsy. All I'm telling you is she, Luisa, decided not to get the biopsy. Her final report that we just got back after now following 4 protocols from the care here in my clinic that I designed for her, April 22nd of 2022. You can see here the ultrasound assessment and the mammogram assessment. And so the mammogram assessment says that the findings are no dominant breast masses. That's right. No dominant breast masses. In her ultrasound from April 22 of 2022, the ultrasound assessment of the right breast fails to reveal any significant cyst or breast mass. The ultrasound assessment of the left breast fails to reveal any significant cystic or solid left breast mass. That's awesome. So we're going to split this into a few different segments. Number 1, we're going to take a break in just a second, and you can listen to what I discussed with Mrs. Luisa, what we discussed here in my clinic recently after we got the report back from the April appointment that showed that the masses are gone. So you're going to take a break. You're going to listen to what she says, and what I said was I discussed this with her. It's very quick. And then we're going to come back from that break, and I'm going to make you a free offer, something you can get right on my website that you can get for free today, right now. And then after that free offer, I'm going to take you through a journey from one ultrasound and mammogram to another ultrasound and mammogram to another, and to the final 4th report, or the 4th study that showed that it was totally gone. So you're going to hear the transition of what her breast went through. Furthermore, I'm going to describe just a few points of my unique exam findings that I discovered with her that helped her get her to completely resolve, to completely eliminate very safely with no surgery and no medicine and no radiation, to resolve these masses in her breast completely with my method. Let's take a break. Let's hear what she has to say, and then we'll come right back, make you that free offer, and tell you some more information. See you in just a bit. Hello, and welcome to another amazing video that I've got to share with you. My name is Dr. Herman. I'm with a great patient. Her name is Luisa. She came to my clinic a little over a year ago because she found through examination with another physician that there was a mass in her right breast and 2 masses in the left breast. Correct? That's what
Correct,
it was.
yeah,
Yes.
that's right.
And now, with only using my treatment that I provided her, the mass in the right breast disappeared,
Disappear.
and the masses in the left breast also disappeared.
Yes.
Right?
Yes.
We have proof of this on reports that I'll be showing you in another video. But right now, we just want to hear, Luisa, did you have any other treatment from any other physician?
No.
To
no, no.
And was there any medication?
No medication.
Only treatment with me.
Only treatment.
Was there any surgery to remove these masses from the breast? Was there surgery?
No.
Cirugía, no surgery.
No.
No cirugía. So you're right now. We see these masses are gone,
Gone.
Gone.
Yes. Yes.
and so it was only from this treatment with me.
Yes. Only
That's it.
with you.
Thank you.
Thank you.
So we just wanted her to share with you that there was no surgery, no other medication, no radiation, no X-ray treatment. What
Nothing.
Nothing else. Only
Nothing
this.
else.
Okay.
Only with you.
Thank you. So we're going to, and thank you for getting on camera with these people, because women need to know it's possible.
I know.
Yeah.
It's, a lot of women need to.
Yeah.
Yeah.
So I'm going to get to another video right now, and I'm going to share with you what I did and how this service that I provide people worked for her and how it can possibly work for you too. See you soon.
See you soon. Thank you.
That's it.